Thanks for staying with us. Let's talk health matters now. The Nigeria Center for Disease Control and Prevention says it will continue to pay close attention to the ongoing COVID-19 situation in other countries. This will enable it to gather additional surveillance data to take actions which may include enhanced surveillance of travelers at airports. Health correspondent Kemi Balogun has more.
The Presidential Steering Committee recently reviewed and relaxed the COVID-19 safety measures and travel protocol due to a decline in cases and a steady increase in vaccination numbers across the country. Other countries are now battling to curtail rising COVID-19 infections, leading to rising tension about the likelihood of its importation into the country. While some Abuja residents say precautions need to be heightened to forestall an importation of the virus, others believe that the country has nothing to worry about.
Of what is going on in China. Now, the situation in the United States is somewhat different. There is an increase in cases.
Considering that Nigeria has relaxed its COVID-19 protocols, what is it going to do now to tackle this resurgence? Considering we have relaxed our COVID-19 protocols, what is the nation doing? What is the NCDC doing to tackle this resurgence?
Well, as I've explained, there at the moment does not seem to be any reason to completely go back to the previous situation with COVID. Okay, there are no new variants from China. There's a new Omicron variant in the United States, but going from the lessons of 2021 when Omicron first emerged, we know that there's increased transmissibility. We know that there might be increased number of cases as are being seen elsewhere, but these have not been associated with increased number of cases that require hospitalization or deaths in our part of the world or in other parts of Africa, for example. So at the moment, in terms of what we can do, is we are monitoring the situation closely, and we will act if there's a need to take action. However, rather than plan for lockdowns or restricting travel, which in the case of Omicron did not have an impact in 2021, I believe that for citizens who are worried about what to do, this is the time, if you have not been vaccinated, to ensure you get vaccinated. If you have previously received your vaccinations, please go and get your booster doses. If you belong to the high-risk groups for severe COVID illness, or such as being old age or having cardiovascular disease or underlying chronic diseases like diabetes, or if you're receiving cancer treatment or you're a recipient of organ transplants and the like, please make sure you get your vaccines, including all of the booster doses that are available. Also, practice the recommended public health safety measures. Use your mask, practice hand washing, and avoid crowding where you can.
All right, Dr. Adetifa, there might not be cause for alarm just yet, but this is an election year, and already there are concerns that if this continues at the rate it did in 2020 and 2021, there might be an issue to actually contend with. But aside from that, let's talk about local manufacturing of vaccines, because this might just be the way to deal with this head on. What level are we on this?
I mean, this is an important question, but it is being asked, it's not related to the subject at hand. Okay? We need the population to get vaccinated. We've achieved just over 50% by the end of December, and the target is to reach 70%. All of the vaccine doses that are required for us to reach that level are actually available. So we do not have a manufacturing problem or a vaccine dose availability problem at the moment. If we are talking specifically about what to do in terms of protecting ourselves against current and future threats by COVID variants. There are enough vaccine doses in country. Our colleagues at the National Primary Healthcare Development Agency, who has the mandate for vaccination, can confirm this. And all we need are for people to turn up to get these vaccines into their arms so that we can achieve the level of protection that we desire for the country.
All right, then. I've been speaking with the Director General of the Nigeria Center for Disease Control, and that's Dr. Ifedayo Adetifa. Thank you for your time on TVC News at 7. Wishing you and the team all the best.